Good day, fellow learners. This is your mentor, your fact check buddy, Gapuz, once again joining you for another teaching and learning session, this time around for the next generation NCLEX RN. So let's proceed with our pointers session. So this is actually pointers number 10 for the next generation NCLEX RN. Please do pay for particular attention to the fact that still my other videos on the standard NCLEX RN pointers contained in our quick fix session are still very, very much relevant for the next generation NCLEX. So please, if you may have the time, kindly scroll down our channel and look for those videos, okay? So here we go. If you want to join our thousands of passers from around the world, give us a text or call at 0906-201-9383 or send me an email at info@ragapuzreview.com. So before anything else, congratulations to Ms. Diane Ortiz, USRN, who passed the next generation NCLEX for the State Board of New York last May 18, 2023. And Diane has always been very, very open in terms of communicating with me. In fact, this is the email she sent me last January 10, 2023. Good day, Sir Ray. Look at the heading. Please help my brain cells. Thanks for being generous to your students. I would like to ask for your help. My exam is on May 18. Bagong set na po. Hu. She's talking about next generation NCLEX. My brain cells are deteriorating because of aging. Ha. I am a mother of 3 also. Ano po ba ang mga tips after po dito sa class ko? Should I attend again the review until my exam date? Feeling ko po kasi hindi nare-retain sa akin after ng lecture yung na-discuss. Thank you very much po for answering my email and for helping po. May God bless you with good health and longer life. Best regards, Diana. So we had a couple of email exchanges after that, and this is what she said after receiving her results. Sir, nung una po akala ko parang politiko ka lang na sasabihin na mag-email lang sa'yo. I first emailed you before na please help my brain cells. I did not expect na sasagot po kayo. And along the way po, nakita ko ang purity ng heart mo na makatulong sa aming mga nurses para gumanda ang life namin through sharing your wisdom and ang pagiging life coach niyo po. Maraming salamat po talaga. Sabi ko nga po sa email ko, you are our modern Florence Nightingale. Salute to you, Miss Diane. Okay, and she paid me a visit early on today, this morning, here at the Ray Gapuz building at UN Avenue. She came to my office in the second floor and at the second floor, rather. Okay, so what are the things that I'd like to highlight related to next generation NCLEX coming from an expert's point of view? So let's begin with Risperidone. That's the generic name, or Risperdal, the brand name. Now take note, this is an atypical antipsychotic. When we say atypical antipsychotic, focus on this class. It will definitely decrease or manage both the positive and the negative symptoms of schizophrenia. When you say positive symptoms, remember DH lawak, delusions, hallucinations, looseness of association, okay, agitation, word salad, ambivalence, and confusion. And when you say negative symptoms, these are the symptoms that always begin with the letter A, except for ambivalence and agitation, which are positive symptoms. So the negative symptoms are alogia, or poverty of speech, or illogical speech, apathy, or blunting of the affect, dulled emotional reaction, absence of emotional reaction, asociality, which means the patient is socially withdrawn, avolition, lack of motivation, or they do not find engaging in interactive activities. So that's avolition, lack of motivation. And then anhedonia, lack of interest in pleasurable things, including sex. Okay. So what I'd like to highlight regarding risperidone is the most common side effect, which is dryness of the mouth. Now, take note that when drying of the mouth is drug-induced, it's not prudent to increase fluid intake of the patient. That could potentially lead to fluid retention. That can potentially result to your dilutional hyponatremia. So the best intervention for the drying of the mouth would be to instruct the client to chew on sugarless gum. And the other side effects would be nausea, vomiting, diarrhea, and constipation, NVDC. Now, pay particular attention to the fact that your risperidone have adverse effects that you would need to report to the healthcare provider or the physician right away, like irregular heartbeat, which could progress to arrhythmia and seizures, and definitely neuroleptic malignant syndrome. The neuroleptic malignant syndrome is characterized by three common manifestations. You have your hyperthermia, temperature above 38.5 degrees centigrade. So the drug that is given to manage that is bromocriptine or parlodel. And of course, you have muscle rigidity that could be managed by amantadine, and of course, your dantrolene or dantrium, and diaphoresis, which usually is managed by administration of IV fluids. Now, patients with neuroleptic malignant syndrome could also have altered level of consciousness. So pay particular attention to those things which I have highlighted for risperidone or risperdal. Next, remember this functional concept. Risperidone is an atypical antipsychotic used in the treatment of schizophrenia and bipolar disorder. So usually, your risperidone is given together with your anti-manic agents, lithium, primarily to control agitation because lithium is not fast-acting enough. So remember, the effects of lithium occurs after 1 to 2 weeks or 10 to 14 days. So while we're waiting for the effects of lithium, your risperidone would usually be exerting its therapeutic effect. Remember, it's an atypical antipsychotic. Next, you have your loxapine or loxetane. Once again, your loxapine or loxetane is also an antipsychotic. But to differentiate it from risperidone, risperidone is atypical antipsychotic. Your loxapine is typical antipsychotic. Now, what's the difference? Your atypical antipsychotic like risperidone will decrease both the positive and the negative symptoms of schizophrenia, whereas your typical antipsychotic like loxapine or haloperidol, Haldol, okay, this will just decrease the positive symptoms of schizophrenia. And when we speak of the positive symptoms of schizophrenia, we have DH LAWA, okay? Delusions, hallucinations, looseness of association, agitation, word salad, ambivalence, and confusion or confused thoughts. Now, what are the common side effects of your loxapine? First and foremost, the drug will cause drowsiness. So there's always a risk for the patient becoming dizzy. So it's very important that the bedside rails are up after the drug is administered, and the patient may experience pseudoparkinsonism like mask-like face, pill-rolling tremors, bradykinesia, monotonous voice, and they can potentially develop tongue twitching or lip smacking, that's your tardive dyskinesia, and restless leg syndrome or akathisia. Now, let me highlight one important thing. Your loxapine, which is a form of typical antipsychotic, like your haloperidol, may potentially increase the secretion of prolactin that could lead to galactorrhea. So you will hear patients taking this medication, loxapine, to be telling you that they have milky nipple discharge. Do not mistake that for a delusion. That is not a delusion. So even if you have a male patient taking loxapine and the male patient is telling you that there's milky nipple discharge, you consider that, you document it as a side effect of the drug because your loxapine can really cause enlargement of the male breast, okay? So pay particular attention that this is a side effect of the drug, meaning, medical terms, gynecomastia. Now, for females, on the other hand, there could be an alteration of menstruation. So the menstrual cycle could become irregular for the patient who is taking loxapine or loxetane. Pay particular attention to the side effects which I have highlighted. Remember, loxapine is a form of typical antipsychotic used in the treatment of schizophrenia and may cause, as I've been telling you, galactorrhea. Okay? Or you have your milky nipple discharge together with gynecomastia or enlargement of the male breast. Okay. Next, you have your cetirizine or Zyrtec. This is an antihistamine. It's used in the treatment of allergies like conjunctivitis, runny nose, and take note, When a patient with allergic reaction develops hives, okay, this requires immediate attention. Why? Because hives can potentially lead to throat swelling. So like if the patient has taken some amounts of peanuts and then eventually the patient developed hives, that could potentially lead to laryngeal edema and airway obstruction. So instruct the patient that if they experience sedation when they're taking cetirizine, the best time to take it is in the evening. But if they're not experiencing sedation with cetirizine, they can take it at any time of the day. So remember, hives would require the nurse's immediate attention. That's why you have to be ready with your cetirizine. Okay? Remember, cetirizine is used to treat conjunctivitis, runny nose, and hives. So, the second important thing if you are studying for the NCLEX, use technology. Once again, here at the Ray Gapuz system, we have the best technologically aided learning environment with our publications and, of course, our Ray Gapuz course shell, the tool that's assisting a lot of nurses worldwide pass the NCLEX next generation on their first try. So give us a call or send us an email message to avail of this for free. We're going to have it raffled off for the free access on June 25. So keep watch and register early. And of course, the third one, conducive environment. So we have here our NCLEX simulation room at the second floor of the Ray Gapuz building at UN Avenue. And of course, our very intimate and well-managed class. Okay, so may I invite you to join our next generation RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, QBank plus 3 books, and then the next generation NCLEX strategies and sample questions by Dr. Ray Gapuz, including your 3 days quick fix session. The fee starts at 3,499. Once again, this is your mentor, your fact check buddy Ray Gapuz saying thank you for joining me in this video. Until our next video. See you